Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about lithium. Lithium is a drug first approved in 1970 for treatment of acute mania. And then in 1974, it gained approval for prevention of recurrent attacks of mania. Mania in bipolar disorder. It's on the World Health Organization list of essential medicines. And it's a basic element. It's on the periodic chart. It sits right next to sodium. Medically, it's used as lithium carbonate. Each 100 milligrams of lithium carbonate contains 19 milligrams of lithium. Comes in either the immediate release form, but you have to take 3 or 4 of those a day. Better yet, you could take the controlled release form. You only have to take 2 of those a day. It's generally used for adults. However, in certain circumstances, may be used for children as young as age 12, and for exceptional reasons, children as young as 7 or 8. It's considered a mood stabilizer. Main treatments for mania in the mood stabilizer family are either lithium itself or valproate or tegretol, known generically as carbamazepine. And recently the pharmaceutical industry has been heavily pushing the antipsychotics, drugs like Abilify or Vraylar, but they have other kinds of side effects. Now, mania presents as an unusually elevated mood, an excited state, inflated self-esteem, the false sense of well-being. People have grandiose plans. Sometimes the people are restless and have purposeless activities. They have loud and rapid speech, sometimes aggressive and hostile behavior. They have a decreased need for sleep, poor judgment, flight of ideas, and oftentimes abruptly shift topics. People with mania, about half of them are going to respond to just one single drug, monotherapy, but a significant number are going to take at least 2 different kinds of drugs. Lithium may be combined with an antipsychotic or valproate combined with an antipsychotic. It's important to begin therapy as soon as the condition is noticed, because if people have bipolar disorder that keeps cycling over a period of time without gaining therapy, people will develop certain kinds of cognitive deficits that become permanent and become increased in number. So we want early kind of therapy. Now, lithium itself, in addition to being used for mania, is also used in some circumstances for people who have failure of therapy for depression, major depressive disorder, with the standard kind of therapy, or people who have schizophrenia, people who have impulse control disorder, and certain mental disorders in children are treated with lithium. It's more widely used in Europe than it is in the United States. The problem with the drug is it has a narrow therapeutic window. You have to get the concentration just right. Too little isn't going to work. Too much is going to cause significant potential for side effects. As a result, people need their blood tests. And blood tests vary frequently when they start therapy, like maybe weekly, and then ultimately every 3 to 6 months. Once you start taking lithium, it takes about 6 to 10 days for it to become effective. It doesn't become fully effective for up to 3 weeks. So people with acute mania might need some kind of immediate stabilization, for instance, with a short course of benzodiazepines, drugs like Valium or the antipsychotics, that seem to work faster. When it's used off-label, for instance, for treatment of major depressive disorder, can take 6 to 8 weeks like most of the other kind of therapies. Well, the drug doesn't cure mania. It's not like treating pneumonia with penicillin. You take it and you stop and you're better. With this kind of therapy, with mania or manic depressive disorder or bipolar disorder, long-term therapy is necessary, even if the person feels well, because the history of bipolar disorder is multiple recurrences over a period of time. Range from depression to normal, to mania to normal, to depression to normal, and just cycle. Well, if we look at all of the therapies that are used for people who have mania, about 8% of them are receiving lithium by itself, any kind of mood stabilizer, about 25%, an antipsychotic, drug like Abilify, Vraylar, about 20%, And unfortunately, about half of the people are receiving antidepressants. Well, antidepressants for people who have mania are not appropriate therapy, especially in that manic depressive or bipolar disorder family. And unfortunately, about 80% of adolescents with the disorder are not treated at all. Now, it seems that lithium works better in people who have a family history of bipolar disorder, people who are what we call euphoric. In other words, they're not dissatisfied with life, not dysphoric, people who have discrete episodes, and people who cycle from mania first, then to depression, then to being well. Lithium works less well in people who have rapid cycling depression, who have multiple episodes before they even begin therapy, people who also suffer from anxiety or substance use disorder, or people who go in the cycle from depression and then to mania. Well, remember, we have a progressively deteriorating course, so we need therapy relatively early. That is the most important thing, to make the correct diagnosis and begin therapy for people. Well, general advice, as with any kind of medicine, keep it away from children. It should be taken with food in order to decrease the incidence of nausea, taken with a full glass of water, not hot liquids. Hot liquids are not appropriate at the time you're taking the drug. Changes the absorption. If you forget a dose, you can take it as soon as possible, as long as it's not too close to the next dose. You don't want to double up with the drug. You have to drink about the same amount of water every day. Drink plenty of water. Have adequate amount of water with salt in your diet. If there's any change in your diet, or you have any weight loss, or you go on a crash diet, you must discuss it with your doctor, because it's going to change the concentration of the drug in the bloodstream. And if you get sick, maybe you have the flu or some other kind of virus that might lead to some vomiting or diarrhea or loss of appetite, you better discuss that too with your doctor, because side effects frequently do occur when you begin therapy. A lot of people suffer from dizziness or drowsiness, or they seem to be less alert. You have to be cautious when you're taking the drug. If the weather is hot, it's summertime, you sweat excessively, you exercise excessively, you go into the sauna, or you have an infection and you have vomiting or diarrhea, because those are going to change the electrolytes, change the chemistry in your body, and that's going to impact upon the lithium levels. You have to call the doctor if you suffer from any kind of significant consequence. So anybody who has lithium, who takes lithium, and then suffers from hallucinations or confusion, or the eyes seem to become crossed, or you have some pain in your fingers and your toes, or they become discolored, either purplish or whitish, or people with chest tightness or shortness of breath, or irregular heartbeats, or dizziness, or blackouts or seizures, absolutely, you need to call the doctor right away. But when you discontinue the lithium for any reason, you have to discontinue it slowly over a period of more than 4 weeks in order to reduce the likelihood of a manic attack recurring. When we talked about the blood testing a moment ago, it's readily available, it's relatively inexpensive, it's accurate, and it's easy to monitor the amount of lithium in the blood, and it has to fit in a certain range. We like to treat the people in the relative lower end of that range, especially if the people are elderly. On the other hand, in children, they seem to need to be in the upper end of that range. Now, the blood testing is very important in order to reduce the likelihood of toxicity. And as I mentioned, we do it relatively early at the beginning of therapy, every 3 to 6 months after a person's been on the therapy for a while. And the timing of the test is very important, obviously, in order to find out what the levels are. We want to do it just before the next dose. So you don't take a dose and then go to the doctor to get your blood test right away. You wait until close to the time when you're going to take the subsequent dose. That's when you need to do the blood test. And the blood test isn't just for the lithium. The blood test is to make sure your kidneys are functioning well, and your liver is functioning well, your thyroid is functioning adequately, there's a correct amount of sodium in the system, and calcium. Even check the urine. The dose, therapeutic dose, typically anywhere between 300 and 1,800 milligrams a day. Sometimes it's higher. People who have acute mania, typically treated with 900 milligrams twice a day, or 600 milligrams 3 times a day, so that's a total dose of 1,800 milligrams. On long-term therapy, it can be reduced down to about 1,200 milligrams a day. That's 600 milligrams in the morning, 600 milligrams at night. If you're pregnant, don't take the medicine. It's not appropriate. If you're going to take the medicine, you should be using a contraceptive if there's a possibility you might become pregnant. The drug may cause some cardiac abnormalities in the fetus. Better choices if you suffer from manic depressive disorder, bipolar disorder, mania, and you're pregnant, well, maybe Lamictal is probably a better choice, or maybe even gabapentin. Nursing, it's thought to be probably safe, but the guidelines suggest it not be used. The pediatric group talked about. Geriatric population, people over age 65, well, because of decreased liver and kidney function, decreased heart function, you have to be a little careful, and the dose should be relatively conservative. Conservative because the kidneys are the area that excretes the chemical from the body. It depends on something known as the glomerular filtration rate, the amount of blood that's filtered by the kidneys. And it seems that as we get older, the kidneys aren't functioning quite as well, so it's not going to remove the lithium. So in an average individual, middle-aged individual, the half-life of the drug might be anywhere between 12 and 24 hours, but in a senior citizen, the half-life is going to be 36 hours or so. So the body isn't getting rid of it. So if you're taking it at the same dose, it's going to accumulate in the system. It's rapidly absorbed by the intestines, and it seems that it takes about 5 days worth of therapy in order to get a steady state. Now, the drug is considered a dirty drug as far as the mechanism of action is concerned because it has so many different actions. We don't exactly know what it's doing or why it's working, but it seems to work. Some of the actions are, it works on the neurotransmitters and their receptors, it works on the kinases, it works on the genes and the transcription factors, it works on the serotonin to increase it, it decreases the release of norepinephrine, it works on the sugar metabolism, the glycogen. It seems to activate something known as mTOR, and that decreases brain inflammation, protects the nerve cells, actually can stimulate the regrowth of some nerve cells, and it's important for its action on cognition and mood regulation. The drug also works on nitric oxide signaling and the NMDA receptors, works on the GABA receptors in the brain, and it changes the sodium transport in and out of the different cells. And even as late as 2017, a new action was discovered that might actually be closer to its real function inside the body. Well, the drug, or the chemical, was discovered in 1817. In the 19th century, it was used to help dissolve uric acid kidney stones. It was used as a treatment for gout, and it was also used as an anticonvulsant. It's sort of a general purpose pick-me-up. It was used for nervousness, even for people who had cancer. In the early days, in the 1800s, it was thought that depression was linked to excessive amounts of uric acid in the system. That was called brain gout. So it was used in a large number of patients. And interestingly, in 1920, the Howdy Corporation of St. Louis came out with a lemon lime soft drink. It was originally named bib label lithiated lemon lime soda. Subsequently, the Food and Drug Administration said, hey, lithium can't be used as a drug, get it off of the market. And then they changed the name. They took the lithium out of that soda that now everyone knows as 7-Up. The 7 is the atomic mass of lithium. The up refers to the mood elevation of the drug. Well, there were hot springs in Georgia, lithium springs. People used the water as tonic water. It was very helpful, it was thought. Pills were available. And the pills were available, but people used them indiscriminately. And as a result, a significant number of people suffered from weakness and tremor and blurred vision as they got overdoses. Well, in the 1940s, lithium chloride was used as a substitute for table salt, which is sodium chloride. It was used for people who had high blood pressure, heart-related disease. But unfortunately, people were getting toxic levels and sometimes even lethal levels. That's what led to the ban from the Food and Drug Administration. Lithium was off the market 1949 to 1970. In 1949, a psychiatrist in Australia, Dr. John Cade, was taking some urine from schizophrenic patients and getting rid of the uric acid, solubilizing it, so he added a little bit of lithium, and then gave that to rodents. And all of a sudden, those laboratory rats, they became very calm and tranquil. So as a result, they started using it for people who had mental problems. That started off in Denmark with a study in 1950 where they compared the use of lithium to electroconvulsive therapy, or ECT, which was the standard therapy at the time. Certainly taking a pill was easier and it was more convenient to treat the patients. Then it was popularized in the late 60s. And then the government changed the regulations back on the market in 1970. But lithium has, in spite of all of its good, it has the potential for a significant number of side effects. So it can lead to restlessness and decreased appetite, increased weight or weight loss, or thirst, or excessive urination and dry mouth and hand tremor, little fine hand tremor, or sedation in some people, slurred speech, hair loss, acne, discoloration, as I mentioned, of the fingers and the toes, excessive salivation, tiredness, problems with cognition, with memory, with goiter, with walking in a manner similar to a patient with Parkinson's disease. And sometimes people develop confusion or nausea or constipation or diarrhea, headache, problems with reflexes, muscle twitches, and even ringing in the ears. And then, because of a pressure buildup inside the brain that we call pseudotumor cerebri, some people develop problems with their vision, maybe double vision, pain in the eye, headache, nausea, and vomiting. And it could unmask an abnormality in the heart rate that could lead in some people to unexplained fainting and lightheadedness and trouble breathing. It leads to hypothyroidism. So about 15%, 15% of women and about 3% of men taking the drug are going to become hypothyroid, especially people over age 50, because what the drug does is it decreases the production of the thyroid hormone and prevents the conversion of the thyroid hormone your body makes to the active form that your body uses. The risk is greater in women taking large doses, women who are obese, or rapid cycling from depression to mania, and people who have pre-existing thyroid disease. And it can cause kidney problems, a problem that we call nephrogenic diabetes insipidus. Now, this isn't the diabetes with the sugar. This is the diabetes with the water. And it can cause problems in about 10 to 50% of people. The lithium interacts with and prevents a hormone from working on the kidney, and as a result, you urinate excessive volumes. That leads to increased thirst, increased appetite, can be reversible early, simply with treatment with another medicine, but later on it may be a permanent problem. So it has to be evaluated. That's another reason why you need blood tests and the urine test. Well, it can also lead to a decrease in renal function. Now, it can cause renal tubular acidosis and some other kind of problems where the kidneys excrete an awful lot of protein, something we call nephrotic syndrome. Rarely it can lead to chronic kidney disease or end-stage renal problems. It seems that from the time you start taking the drug till you notice some of the chronic kidney problems can be as long as 10 to 15 years. Not significant problems in most people until after they've been taking the drug for about 30 years. The drug can also cause the serotonin syndrome, has a significant number of issues. The neuroleptic malignant syndrome, where the body temperature goes up very high and the muscles break down. When you start taking the drug, the typical side effects are just gastrointestinal, nausea, vomiting, diarrhea. Then subsequently come on the neuromuscular problems, the tremulousness or the hyperreflexes or the dystonia with your muscles, and then later some cardiac rhythm abnormalities. And then chronically, if you're going along just perfectly okay taking the drug, but now all of a sudden you have a change in your volume. Change in your volume because you're not eating right, you're taking a new water pill, you get some food poisoning, you're exercising too much, or you sweat profusely, or you start taking a new drug, then you can develop signs of chronic toxicity. Chronic toxicity, typically neurologic symptoms rather than the gastrointestinal symptoms. So some of the symptoms might be the nystagmus or the tremor or the change in your mental status or poor judgment. You have to be careful. If you combine lithium with herbs and vitamin supplements, and even if you just drink alcohol, if you drink alcohol, alcohol can cause you to urinate a lot. That can cause some dehydration. That leads to problems. Can cause a problem if you're taking a diuretic. Can cause problems if you take aspirin or other non-steroidal anti-inflammatory drugs like ibuprofen or Motrin. That decreases the kidney function and then increases the concentration of the lithium in your system. And the same with ACE inhibitors, popular drugs like lisinopril or enalapril. They decrease the glomerular filtration rate. Also, issues if you happen to be taking other kind of medicine. So if you take metronidazole for a vaginal yeast infection, a calcium blocker for your blood pressure, maybe an opioid for pain like oxycodone, and we can get that serotonin syndrome or other problems if you take a drug in the Prozac or Celexa or Lexapro family. And even though it's combined with the antipsychotics, the combination can lead to an encephalopathic syndrome with weakness and lethargy and fever and tremulousness and confusion and ultimately irreversible brain damage. So the drug has very important role in medicine, but it has to be treated with due respect because it has an awful lot of side effects associated with it. The cost of the drug, if you get the immediate release form, you can get it for as low as $4 a month. For the controlled release form, well, a month worth of therapy cash is going to cost about $50 with a coupon from GoodRx, little as $25. However, if you get the trade name drug, that could cost about $1,000 a month. Now, interestingly, with lithium, lithium is in the water. It's a natural mineral. And some areas have more, and some areas have less. But typically it's less than 1/1000th of the amount that we use medically. But interestingly, in those areas of the world, including areas here in the United States, where there's more lithium in the water, there's an improved mood, up to a 40% reduction in the incidence of suicide, reduced depression, reduced crime, reduced Alzheimer's disease like dementia, decrease all-cause mortality in bipolar disorder, increase in the volume of the central nervous system of the brain. In the United States, we find most of the lithium in the highest concentrations. In the New England states and in the Smoky Mountains, it's also present in food and grains and meat. And interestingly, some of the studies in humans have shown increased gray matter in the volume of the brain in people who are consuming lithium, help in preventing damage from acute brain injury, increase in the length of the telomeres that are sort of a sign of the aging process. It helps prevent some mental disorders, prevents the accumulation of amyloid protein in the brain that's linked with Alzheimer's disease, and reduces the amount of tau protein also associated with Alzheimer's disease. So lithium is centrally rooted in the treatment of mania. It has impressive therapeutic results, but it's potentially toxic, and it has to be treated with significant respect. And if it is, and if we watch your blood levels to make sure it's not building up to potentially toxic amounts, then this therapy is about as good as it gets for treatment of mania. Thanks for watching. I'm Dr. Ken Landau.